Hi, today we are going to talk about very important disease and its homeopathic treatment and prognosis. The disease is underactive thyroid. It is also called hypothyroidism, in which the thyroid gland that everybody has some kind of dysfunction whereby it doesn't work, doesn't behave up to the mark. It has hypofunction. Its functioning is low and low. As a result, what happens is that certain hormones in the body, T3 and T4, they become low, and the TSH, which controls the T3 and T4, becomes elevated. Hypothyroidism has been increasing enormously in India, and is believed to be around 11% of the Indian population has underactive thyroid. In the US, it is said to be around 4% population suffering with hypothyroidism. It is a metabolic disease. My name is Dr. Rajesh Shah. I am a director of Life Force, and we have been treating patients from across the world, including the diseases such as underactive thyroid. We'll talk about the prognosis or the scope of treatment with homeopathy for this condition, underactive thyroid. Well, by and large, when one is diagnosed having underactive thyroid, it is a common practice to put the patient on the thyroid supplement from outside without much hesitation, without really understanding why is one having a hypofunction of the thyroid gland. Homeopathy does not treat by giving an external supply of thyroxine or thyroid hormone. Homeopathy tries to activate the thyroid gland in such a way that it will start functioning properly and it will start producing its own required quantity of thyroid hormones. Now, the prognosis or the scope of treatment depends on fundamentally the capacity of the thyroid gland in a given patient to get activated. And we have no measure to find out in advance whether this patient's thyroid gland is capable of getting reactivated or rejuvenated. But our experience says that those patients who have been diagnosed having hypothyroidism or underactive thyroid for less than 2 years, and those who are not on the thyroid supplement, the external supply of thyroid gland for more than 2 years, are likely to respond to homeopathic treatment. That is our experience. So we usually take up those cases who are of recent origin up to 2 years. Now, what does homeopathic medicine do? Homeopathic medicines try to activate the thyroid gland, as I said. And in this process, even if the patient is taking some supply of thyroxine or thyroid hormone from outside, we strategically and slowly reduce the external supply of thyroid hormones and monitor the thyroid levels in the body after giving homeopathic medicines. In many cases, I would say 60 to 70% of the cases which are of recent origin, we have seen that we are able to activate the thyroid gland and slowly, even successfully stop the external supply of thyroxine hormone, and whereby the patient's thyroid glands get activated and they produce normal quantity of thyroxine hormone. The success rate is significant. The treatment is based on the fundamental understanding of the totality of the patient's symptomatology, and which also includes the causative factors, the genetic factors, the immunological factors, and so on. Based on that, homeopathic medicine is determined for such cases. So as I said, we give homeopathic medicines and try to taper or reduce the conventional thyroxine hormone. We may be successful, we may not be successful. So in the cases where we do not succeed in this process, we may have to possibly go back to continued supply of thyroxine hormone, and we may stop homeopathic treatment in those cases where homeopathy may not really work. Scope of treatment is also defined in terms of whether we can completely cure underactive thyroid. As I said, we can cure some of the cases completely. In other cases, we are able to reduce the dependency on the thyroxine hormone. So, for example, the patient who has been or might be consuming thyroxine hormone of say 100 mcg per day, we may slowly reduce it to 75 mcg per day or 50 mcg per day or maybe 25 mcg per day. So we are able to reduce the drug dependency of thyroxine hormone in many cases where we may not be able to even revert the disease. The duration of treatment with homeopathy, it depends on, again, number of factors and the chronicity of the disease. But by and large, I would recommend that such cases, they require treatment for about 8 months to maybe 2 years or even longer. During this time, we not only reduce the drug dependency, but we eventually target at stopping the homeopathic treatment and monitor the patient's thyroxine, T3, T4 and TSH hormonal levels in the blood post stopping homeopathic medicines. Homeopathy is, of course, strongly recommended for the cases of underactive thyroid or hypothyroidism. As I said earlier, up to about 2 years of development and maximum up to 2 years of dependency on the thyroxine hormone. I hope this experience-based prognostic tips would help the students of homeopathy, the medical students from all across, as well as the practitioners of homeopathy and the general public. Thank you very much.